For your USMLE examination, you are required to know the difference between type 1, also known as alpha, and type 2, also known as beta error. And sometimes they're asked in different contexts where you're supposed to say whether it's a false positive or false negative results, or sometimes you're required to know whether it's rejecting or not rejecting a null hypothesis that is either correct or incorrect. So here I'm going to provide you some examples after which these definitions would be easier to understand. So let's say that, just for argument's sake, in reality vitamin C does not improve cold, and on the other hand aspirin decreases the risk of myocardial infarction. So these are the true findings. Now let's say that here our null hypothesis is that aspirin does not protect against myocardial infarction. So aspirin does not protect against MI. And this is actually a false null hypothesis, because in reality aspirin does decrease the risk of myocardial infarction. So therefore, if we reject this null hypothesis, that would be a correct decision, because by rejecting that we are actually supporting the fact that aspirin does decrease the risk of myocardial infarction. On the other hand, if you do not reject this null hypothesis and say, well, yeah, possibly aspirin does not protect against myocardial infarction, then that's a type 2 or beta error. On the other hand, let's say that our null hypothesis is that vitamin C does not protect against cold. And this is actually a true null hypothesis, because in reality we know that vitamin C does not improve cold. So if we reject the null hypothesis, then that would be another error, and this is referred to as type 1 or alpha error. But then if we do not reject this null hypothesis because it's a correct decision, then that would be correct and it won't be considered as an error. So therefore type 1 error is actually rejecting a null hypothesis that is correct, as here is true. So again, type 1 error is rejecting a null hypothesis that is correct. So type 1 is equal rejecting a null hypothesis that is correct. On the other hand, type 2 error is not rejecting a null hypothesis that is false. So type 2 or beta error is not rejecting a null hypothesis that is incorrect. And that is the definition of type 1 and type 2 error that you will have to be familiar with. Now here I'm going to provide you another example to be more clear regarding these definitions. So let's say that our null hypothesis is that there is no fire in the building. Now what happens if the fire alarm is set off, but at the same time there is no fire in the building? So there is no fire in the building, which means that our null hypothesis is correct, but the fire alarm has been set off. So here we are rejecting, so the fire alarm is actually rejecting a null hypothesis that is correct, because our null hypothesis was that there is no fire. So therefore this would be again another example of type 1 or alpha error. But let's say on the other hand that there is actually fire in the building, but the fire alarm is not set off. So if there is fire in the building, then our null hypothesis is incorrect. So our null hypothesis is incorrect. And then by the fact that the fire alarm has not gone off, then we are not rejecting the null hypothesis that is incorrect. And this is an example of type 2 or beta error. Now you should also note that we never use the terms accept or not accept a hypothesis or null hypothesis. So it's an incorrect terminology to use the terms accept or not accept. Now if you're on an examination trying to figure out which one was type 1 and type 2 error, and you're confused regarding which one is not rejecting and which one is rejecting, and whether the null hypothesis was correct or incorrect, and you're looking for a memory aid, one way you can do it is that beta error, everything about it is negative and bad. So first we are not rejecting, so that's bad, and then the null hypothesis is also incorrect. So everything about beta error is bad. So here, let me go back here again. So see, type 2, we are not rejecting a null hypothesis that is incorrect. So with the beta error, everything is not rejecting incorrect. All right. Now, there could be another way that they would be asking about type 1 and type 2 error, and this would be for screening tests. So let's say that here, in reality, we are testing for cancer, and true means that the patient have cancer, and false means that the patient does not have cancer. And then on the y-axis, we have our screening test. So if our screening test is positive, it means that we have detected cancer, and if it's negative, then it means that we have not detected cancer. Now, if the patient has cancer and the screening detects that, then that would be a correct decision. On the other hand, if the patient does not have cancer and the test is negative, then again, that would be a correct decision. But then, if the patient has cancer and there would be a negative screening test, then that would be a false negative result, also known as type 2 or beta error. On the other hand, if the patient does not have cancer and the screening test tests positive, then that would be a false positive result, also known as type 1 or alpha error. So here on this graph, I'm going to show you what I mean by type 1 and type 2 error. So here, the blue curve is the patients that have no cancer. And then the diagnosis threshold, anyone that falls on the right side of this line is detected as a positive test, and anyone who falls under is detected as a negative test. So therefore, anyone who's beyond the diagnosis threshold is diagnosed as a positive test. But then people here on this blue line, none of them are having cancer. So this would be a false positive result because these patients have no cancer, but the test is positive. On the other hand, there are patients here, this red line, who do have cancer, but then the tests have not detected it. And so that would be a false negative or type 2 error. Now, alternatively, the examiners may ask you what happens to the type 1 and type 2 error if the threshold, for instance, is increased or decreased. And all you have to do is redraw the line here, and you will see how the alpha and beta error will be changed. So here, let's say that this is our new threshold. So the diagnosis threshold has been increased for the test. And so therefore now patients who are having type 1 error would be less than before. So here you can see that the area under the curve is much less than what it used to be. So therefore, by increasing threshold, type 1 or alpha error decreases. On the other hand, the area under the curve for patients who did have cancer and has not been detected by the screening test has increased. So this is our new area. So therefore, beta or type 2 error increases by increasing the threshold. And then if they ask you what happens by decreasing the threshold, a reverse of what I just described here. So by decreasing the threshold, alpha error will increase, but then beta error will decrease. And that concludes our discussion of type 1 and type 2 errors.